Hi, I'm Danica Cooperins.
And I'm Sharon Hughes-Geeky. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community.
Today, I have the privilege of interviewing Dr. Kira McClellan. Thank you so much for being here.
Thank you, Danica. Pleased to be here.
She is a graduate from the Memorial University of Newfoundland, originally from there, with her MD and a residency grad from McMaster. She's a full-time, full-service family practice in Armstrong, or she has one. I guess you do work in a team, but did you always work in a team?
We created our team back in 2008. So I've been there since 2003, but we created our team 2008.
She works in palliative medicine, including in hospital, in long-term care, or in home. She works acute inpatient care, and she specialized in sexual health care at Options for Sexual Health. She does a lot of leadership work. She's a huge advocate in our community, and we'll get to talk about that as well. But she completed her 5th year as department head, Department of Family Medicine at Vernon Jubilee Hospital. And she just stepped down after 5 years of Vernon Jubilee Hospital Medical Staff Association and Physician Society president. She's partnered to a passionate family practice man and a mom to 2 student athletes. She was a former competitive athlete in rowing and mountain biking and an avid ice and rock climber skier. Currently, she's a recreational, very young athlete trying desperately to avoid injury. Thank you so much for being here. Welcome. I have so many questions for you, so we'll just get right into it.
That sounds great. That's very flattering, all of those things, Danica. It sounds like I have 26 hours in my day, which I really do not.
I have wondered about that, though, because anytime I've run into you, I've seen you doing so many different things. I just seem to believe that you just have more time than I do.
It's my own
I don't know how you do it.
Scheduling expert. We'll get to that
I know
later.
you must have an assistant.
Oh, yes, my husband.
Oh, that's awesome. So my first question kind of tails off of our introduction there. And traditionally, a family practice physician would have done something similar to what you're doing now in 2025. There's some complexity in that, though, and I want you to just share a little bit about what does it look like to be in a team-based practice, in a community, and then also from the womb to tomb.
Yeah, so family medicine has definitely changed over the years, like most of us know. I think most of the public consider family doctors as still doing that womb to tomb care. And really, it's transitioned to sort of more specialized care for some, especially new graduates seem to be taking an interest in certain areas of family medicine and pursuing that, which is fantastic because we need all of those experts. So there seems to be fewer people pursuing longitudinal family medicine. I chose to continue to do that back when I graduated over 20 years ago. That was still the historic model, and that's what most people were doing. However, it's almost impossible to do it in a solo practice, and there are people that still do that. But I was really searching for a team-based environment with support for vacation time and coverage of results if I was busy or had other things to do. So we actually created our group practice in Armstrong about 16 years ago with that model in mind. So we were a group of 4, actually 4.5 physicians at the time. And we've expanded on that over the years. But essentially, the model that we follow is a group coverage practice so that we all are able to take lots of vacations without a locum. We obviously try to get a locum that helps to cover some of the workload on the others and helps cover a little bit of the overhead cost. But we can do it without a locum. We have all agreed to cover each other for meetings or vacation days or mental health days. We also continue to do inpatient care at the hospital. 4 out of the 5 of us in our group are still quite passionate about that. And we do that in a rotating schedule so that we are not on call every single day of every week for the year. And I think that model has been extremely effective for our group. But it helps us to balance the challenge and the scheduling complexity of doing acute care, but also maintaining our longitudinal practices. And it keeps things fresh. We get to chat with our consultant colleagues at the hospital. We get to network a little bit. We get to know administration. And it's really nice to know our referral consultants personally. So that's one of the huge assets to doing that type of work, besides keeping our skills fresh.
It sounds definitely like a passion for being a part of all things within the community. And I think that's really what I'm excited to interview you about, is just how much you're not only, personally involved in the community, through your children and all of their activities, but also through being a physician as well as such an advocate for other physicians. Speaking into some of these leadership roles that you've had, what does it feel like to step into something like that, coming from both angles, right? Because at the Vernon Jubilee Hospital, but then within the community, if you can just speak about what that role really looks like.
So I think I stepped into my first leadership role in March of 2020, which actually, no, that's not true. It was the fall before. Somewhat naively, I had been part of the Medical Staff Association. We had an executive that managed medical staff affairs and activities, and our president was stepping down, and I somewhat naively agreed to take the position, thinking it would be. Well, I never thought it would be easy, but I had no formal training, very little onboarding, but off we went, and that was my first leadership role 5.5 years ago. I stayed in that role for 5 years. And during that time, I also assumed department head for family medicine at the hospital. And that was right at the beginning of COVID in March of 2020, when our previous department head had stepped down and we had nobody to fill his shoes. So I said, well, gosh, I'm doing all this other stuff anyway. I'm attending all the meetings. So why don't I just do the department head role as well?
It's those moments in life where you find yourself going, I'm sorry, how did I end up here? And what is going on right now?
It didn't feel like a weak moment at the time, but in hindsight, I'm not sure what I was thinking. Anyway, also with no formal training, no onboarding, no orientation, I had really absolutely no idea what I was doing. I'd been a member of the department for 20 years, but all I thought I had to do was run some meetings and away we went. Anyway, clearly there were other responsibilities that I learned along the way. And then I actually was lucky enough to be accepted to the Interior Health Navigate program a couple of years ago. So I actually did receive some formal training through that. So that's a homegrown leadership program that Interior Health developed. Dr. Harsh Hundal and Dr. Mike Ertel were the brainchilds of that program, and were eventually successful in rolling it out through the health authority. And I was part of the second cohort. And it's a 2-year leadership program that is extended through the whole health authority, and is designed to educate people interested in leadership roles or people engaged in leadership roles, to try to give us some skills to do our jobs a little bit better. So I was lucky enough to do that program, and I'm still in my department head role, and I still try to advocate for physicians quite strongly at the hospital. I'm no longer medical staff president, but I still have my foot in some activities there, and I do enjoy the relationships that I formed over the years with our administrative staff and our directors. And we have worked hard to try to get physicians a stronger voice at the table for decision making, and as well advocate for some of the needs of physicians. So I've really quite enjoyed those roles over the years.
This is such a big deal for our community to have physicians so present in the hospital, but also in their practice. And I'm wondering if you can speak a little bit more to what you would love your patients to know, or what the community of Vernon could know about an honor it is that you get to be that, because I know how much you feel it's a privilege. But also just sharing a little bit about why that is your passion, because you've really expanded that.
That's absolutely a huge passion of mine, and I think most people recognize that. So I guess what many patients don't know is that when you get admitted to the hospital these days, it's not always your family doctor that looks after you. Historically in this town, it always used to be, and in smaller towns, it really still is. But in bigger towns, the model of inpatient care has really transitioned to that of doctors that do that full time. So they're still family medicine trained doctors, just like I am, but they have chosen to do hospital work full time, and that's called a hospitalist. Um, I do that part time, but also do my longitudinal family practice, and that's the model that I'm quite passionate about because I think it brings a number of merits and holds a lot of value
Mhm.
for both patient care, physician wellness, but also the system as a whole. So I do think that that longitudinal relationship we have with our patients really can be leveraged to create value in the system because we know our patients so well. We can pick up on subtleties, subtle changes in their clinical conditions that it might take others a little bit more time to detect because they don't know the patient quite as well. So we can pick up those subtleties. We can treat things earlier. We often perhaps maybe do less testing as a result because we know historically what the patients have gone through and perhaps know their clinical conditions or at least are more familiar with that. And then the patients really, really enjoy seeing a familiar face when they're in the hospital. And when they see their doctor walk in the room, it's like their whole demeanor just changes because they feel like somebody knows them, right? And like, oh, you're here, finally. Like, well, I may not have all the
Absolutely.
answers, but we're through that journey. We with our patients over the years, so we really try to continue that in hospital and then bridging back to the community when we can discharge them. And I do feel like the length of stay perhaps can be shorter with us because we are able to pick up on things a little faster. But it's not for everyone. It's very complex to do the scheduling, and it's definitely another thing to layer on your professional life. So I get that it's not for everyone, but I do think there's lots of value in it, and patients really appreciate it.
Yeah, I can see that because what I'm really hearing you say is in such a way you're holistically managing their care through all facets of their health and their health journey. And, if this has been your practice for almost 20 years, then how special to have known these people for that long, some of your patients and their families.
And
So
their
that's
families, yeah.
mhm,
And you
that's
know the dynamic of the family and of the friends of the family and who knows who and you know what might work and might not because of the dynamic outside, once they go home and you're like that's totally going to work because they have, their sister to support them, or that's totally not going to work because we've tried that many, many times. And their wife is having trouble with this or that, and so you do know the whole dynamic, and that's quite interesting some days.
and then how do you feel the team responds to you, the nurses and the other physicians or the specialists when they see you guys there?
I think they appreciate what we bring to our patient care. I think we're all a little bit pressed for time, like most people are. So sometimes we're a bit in a rush, and they know to catch us quickly, or they might not. But I think the team really enjoys working with somebody who can carry on that care plan once they go home, once the patient goes home.
Yeah, absolutely. Thank you for sharing all of that. So I want to speak a little bit about the Waffle House. And this is exciting for me because it's something that's been like almost becoming a buzzword. It's like Waffle House. So what is the Waffle House? And most importantly, why did you start it?
So the Waffle House is an online platform for physicians to connect, essentially. So we created a website, and the website it's actually a two-way website. So we have information that we post on the website, including We have a leadership toolkit that we created as a separate project that we were really passionate about because a lot of us have assumed leadership positions with no formal training. And Navigate is only for a very select number of physicians every second year. We don't have a lot of training for other people doing leadership roles. So we actually created a leadership toolkit that is every single resource on that toolkit, and there's over 100 of them, were individually vetted by a group of physicians and either nixed or accepted. Some have editor pick stamp on it. And that leadership toolkit is part of the Waffle House. It also has a job posting area. And the job posting area is also two-way. So physicians can actually post their own jobs on the Waffle House. So in fact, I posted one this morning for people interested in doing some hospital work through our department, either on weekends or through weekdays, and don't want a long-term commitment. So I posted my own job this morning on the Waffle House. The Waffle House also has a chat function. So through the use of plugins, we've been able to create a chat function. And we've created discussion forums, groups for chatting, as well as you can direct message people. So the chat function, I think, is going to become quite popular. There's a newsreel, there's an events page. So it really is sort of a really neat resource for physicians to sort of come to and hopefully connect. We're initially piloting it in the North Okanagan. So Vernon, Salmon Arm, and Revelstoke have been our test subjects, and we've had people testing the Waffle House, including the leadership toolkit resource and providing feedback. And we try to provide upgrades and change things as we get that feedback. But it's up and running, it's live. Most of it is public facing, so you don't need a login for most of it. But if you want to use the chat function, if you want to post a job or post a news event, then you need a login, and that's pretty simple to create. So yeah, if you're a physician or nurse practitioner or midwife, check it out. It's called Physician Waffle House, but I'd be delighted if others of their practitioners would use it as well.
Yeah, absolutely. And what would be your goal? Like, say 5 years from now, you've done all this work. What do you want to see from it?
I would love to see it spread and to see it spread provincially. So we have created it with that in mind. So we've broken it down into geographic areas. So when you register, you just put your area. And then down the road, if it becomes hopefully quite popular, then you can filter some of your results by geographic area as well. So we've built that functionality into it from the get-go.
Awesome. Wow. So it really is basically a safe place for physicians to log in, ask questions, connect with other physicians, look at jobs that are available in the area, look at some of the research tools. And then I think it sounds like you're going to be expanding even more from there, and it's going to become a larger website essentially.
Yeah, we've contracted a moderator who works on the site in the background, so she can do some web editing for us, fix parts of the site as they come up, and then she also moderates the chat and the postings and stuff as well. So she reconciles the people who apply for a login to sites and to family practice lists to ensure that the people are legit. So yeah.
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 Wow. Oh, that's exciting. This is a big deal. One of the things I've really found in the last few years is personally, I feel like I went from a space of like, don't be on social media, keep your knowledge to yourself, share it with your patients, but it has to be in that realm. And now I feel like we're all realizing that if we want to have more physicians or we want to have more providers in allied health, we actually need to start showing up publicly.
Yeah. So the ironic part is I don't have a Facebook account. I'm not on social media. I have no idea how to even do that. With the exception of WhatsApp. But so that's the irony behind it. But yeah, I think we all realize that the digital age is, you jump on the train or you get left behind. We're hoping it'll be a huge recruitment tool as well for the area. we have an area on the Waffle House to post these videos and other testimonials and recruitment videos. And you'll be able to filter that by region as well if you're interested down the road. So yeah, we've received funding from many different sources with the goal of hopefully improving recruitment in the area.
Yeah. Wow. I want to say you're kind of an activist. Like you see it and you want to support and you just get in there and you're passionate. How has that been received? Has it been, something that's just kind of fallen on deaf ears, or has it been something where people have really grabbed onto it and said, "Yes, go for it. Here's all the support." Or do you feel like it's really all that work has just not really been very effective?
So that's a big question. I think what I have seen grow is relationships between physicians and administration. And I say that with the utmost truth. Administration is quite engaged at our site with physicians and trying to work on projects that benefit well, obviously patient care, but also physician wellness and happiness and joy in their work. Their hands are tied too at times. They work within the constraints of the system. They have limited funding, extra funding to sort of do new things with. They have their ministry mandate letters, which are very, very discreet with asks and with deliverables. So there's not a lot of room to work outside of that, especially with things that require funding. So I think what I have learned is a better appreciation for what the barriers are. I think physicians get frustrated at times and say, well, nothing ever gets done. And, we complain and nothing ever gets fixed or changed. But I think the frustrating thing from my end is that approach without knowing exactly what's happening behind the scenes. So I have developed a huge appreciation for both sides over the years. And I think the most frustrating thing is probably actually from the physician engagement end, if I have to be completely honest. There's a few of us that work pretty hard to try to improve things. And it can't be done forever by a select few. It really needs to be a job that's shared. So I'd like to learn how to help engage others and get them interested. I think that's probably something that needs a little bit of work. And I think COVID really had a huge impact on physician engagement and engagement in all realms and spheres. There's a lot of fatigue after COVID. And I think that's even worse for the couple of years immediately following COVID. And now it's starting to turn around a little bit, and I'm hoping the pendulum will swing back. But people are really busy,
Mhm.
right? We all are. And I think we just have to figure out how to best use our time and energy and our expertise, because we're all experts in our own fields, but we have a lot to bring to the table to try to improve the system as well.
Yeah, absolutely. And I think that that's such a good point, because one of the things I do feel that's unique to the North Okanagan is this community approach that we are separate, but we're not all separate. And as a medical community, I think it's special that people do want to work toward things together. And so I can imagine it would be disheartening when it's kind of like there was that, and then not really, and now there's like a select few. We got to get back to this vision of this is a team. This matters. Every piece that you put in matters.
Yeah, people have become quite siloed in their work over the years, and that wasn't the case 15 years ago. So I think it would be great to sort of find ways, and that's sort of where the Waffle House idea kind of came from, is breaking down those silos and getting people to connect again. Because without each other and that peer support, even if it's just informal peer support, I think there's a lot of struggling that goes on that doesn't necessarily have to. So I think the peer support and camaraderie is really, really important in all of our wellness.
Absolutely. Absolutely. So speaking of wellness,
A good segue.
you're like my inspiration
Nicely
because
done.
you're out there running and competing and just tell me about your day, like a day in the life of you from outside of medicine.
Oh my gosh, Danica.
Don't tell me you wake up at 4.
No, I don't wake up at 4. I do wake up at 5, but that's a forced wake up at 5 because my children swim before school, and the only pool time they can get is at god awful hours of the day, so it's mornings and evenings. I think so. Yeah, my scheduling is very complex, but everyone's is. But when you layer on student athletes, so I call them student athletes because they're full-time students. They go to high school. They're not part of an academy program, unfortunately, because there is no academy program for their sports. They're both swimmers. Thankfully, they're in the same sport. So at least we're sort of at the same destination on various weekends, and that helps. But full-time students, full-time athletes, lots of complex scheduling, lots of travel meets, lots of time away from Vernon to support them in their competitions. And then just trying to fit your own work and health into that schedule. So every week is customized in my life. So there's no like I don't work 8 to 4 Monday to Friday. I schedule my exercise in daylight hours because I don't do well with exercising at night. I schedule my work into dark hours sometimes. So I'll do administrative work early in the morning. That's when I think best. The house is quiet. And then I'll book my clinical work in, and then I always create pockets for emails, pockets for emergencies, pockets of time for, results, pockets of time for my hospital work and meetings, and absolutely pockets of time for my own exercise, shopping, groceries, chores, laundry, and it's all deliberately scheduled into my week. So, so if you ask me what I'm doing next Thursday morning, I can tell you exactly what I have planned. And then what I have learned in my 50 years, and I have gotten a little bit smarter, is that you always need a plan B.
And C and D.
Well, at least a B, but maybe a C and D, because plan A doesn't always come. And I'm trying to teach my kids that always have a plan B.
Yes.
Even when you're driving, I said to my daughter the other day in the car, I was like, I knew I had to be in that lane, but you're getting closer to the turn and you're still not in that lane. And then finally I was like, I think that person's going to turn, I'm banking on it. And they did. So I pull into the lane. I was like, yep, that was plan A, sweetie. She's like, what was plan B, mom? I'm like, well, plan B would have taken an extra 2 minutes to get home. We would have had to turn left at the bottom. But I was really banking on plan A. Anyway, always have a
Absolutely.
plan B. Mm-hmm.
So you're organized and that's how you can do it all and be engaged in everything. And
I'm
you
pretty
also sound
organized.
like you're super into your children's activities and really inspiring that in them. And that's exciting. And they probably, really value having their mom a part of that and around for that.
I've become a swim referee, not a referee, but a volunteer at meets. I officiate. Yeah, I help them get to everywhere they need. Yeah, it's
Wow.
pretty all for sure.
Yeah. So
Hmm.
what's something fun that nobody would know about you?
Oh gosh, I'm not fun.
Yes, you are. You're always laughing. You have a big smile on your face.
Oh, something fun. I don't know. Well, that's a hard one, Danica.
Will
I
you
love to
travel?
travel. What
Yes.
that's boring though. Yeah, I love to travel. I love to travel overseas. I love to backpack with my kids. That's my absolute favorite thing to do in the world because there's no phones. And I tell them you can bring your phone if you want to carry it for 5 days. The battery will probably last a day or two. And we use it for pictures. So we all bring our phones for pictures, but then you can play games all you want on it when you're in the tent. But once that battery's gone, which is going to be in one day, you got to carry it the other 4 days. So
That's
I
smart.
love backpacking with my kids. It's not always easy, but I think it builds resilience and strength.
Yeah, absolutely. And what a fun connection and a healthy way to see the world. Some
Yeah.
of the most beautiful parts of the world too.
Yeah, absolutely.
So my last question for you is really around why the North Okanagan? Why live here, work here? Why do you stay?
So I think the stock answer is it's the perfect balance of recreation and life or professional life. I think that's what most people will give you, and I think it really is. But the North Okanagan definitely speaks for itself in terms of its recreational opportunities, and I don't need to remind people of that. I think from my end, truthfully, as a family physician, I love working in the North Okanagan. I have a small town practice in Armstrong, which is only like 12 minutes from the north end of Vernon. So it's a small town feel to my practice, but at the same time, I get to practice some really complicated and acute inpatient medical care at the hospital in Vernon, with full backup and full support from our internal medicine colleagues who are fantastically supportive of our work in the hospital. So I get to learn from them. I get to network with them. I get to ask them if I have any questions about what I'm doing or how to proceed. They'll step in at any point along the way. So you can really practice like a massive scope of family medicine within your comfort zone, or even just a touch outside your comfort zone, and have full backup from your colleagues. So that's why I love working in this area, and that's what sets it apart from other sites. Um, so as a medium-sized site, it allows us to do that with full support.
Yeah, that's a great answer. Thank you for sharing that as well. Because, of course, lakes and hiking and beauty and wine sell itself.
Totally. Yeah, that's all good too.
Thank you very much for being here. Was there any last minute thing you wanted to share, just that summarized our interview, or that you really were hoping that the community would just hear from you in this time we've had together?
I don't think so, Danica. I think you've captured so many things in this interview. I hope people listen to it, but it's a bit long, so hopefully you can pare it down to just the best parts. Um, but yeah, I think most of us are always open to just chatting about stuff and what we've learned over the years. And I think medicine is totally changing, and family medicine specifically. And we really have to adapt with that, with the new generation, or else we're going to lose family medicine um, in the way we know it. So we have to be very novel in how we approach things going forward. And we need to start creating models specifically that are attractive to new grads. And I'm really motivated to work on those kinds of projects in this area for sure.
Yeah, I can see that. Well, thank you so much for your time, and thank you for being here.
You're very welcome. I appreciate the opportunity.
Remember, thank you guys for listening. I just ask that you continue to follow Docs of Vernon. And if you have any questions, or you want to connect with Dr. McClellan or anybody on her team, or anybody in Vernon or Armstrong, North Okanagan, please, you'll have all the links below. Thanks so much. Till next time.